Hey everybody, my name is Coach Austin. I have a master's degree in exercise physiology, several years of cardiac pulmonary rehab experience, and I'm here to show you how you can save somebody's life or prevent yourself from getting cardiac disease so that you have to have a surgery, procedure, etc. First things first, this is not an easy process, but I can show you the simple ways to be able to effectively implement this into your lifestyle so that you can save your life or your family's lives or friends' lives. First things first, a lot of people in my life have been directly impacted from this. Since the age of 14, I've had individuals pass away due to cardiac disease-related events. This has impacted my life, and I'm here to show you what are the processes to understand and effectively implement ways to help prevent cardiovascular disease. Now, first things first, make sure that you stay tuned because we're going to dig into all the steps in order to help effectively treat this. To dig into Repatha and this specific drug classification and why this would be important for individuals who have cardiovascular disease and how it affects the effective treatment of the disease long term. Now, first things first, you need to talk to your doctor before getting on this medication. But this is an education on the medication and why it's extremely effective in preventing cardiovascular disease long term. Now, let's talk about this a little bit more in depth. One of the big things is it also helps prevent disease-related risk with stroke and cardiovascular disease like heart attack or a bypass surgery or a future cardiac event. An individual who has a risk of these would have a high lipid panel reading of LDL or low density lipoprotein cholesterol. We also can look at the genetic risk factor of APOB, which is also both LDL and APOB are risk factors in cardiovascular disease testing in cholesterol. So if you have high blood pressure, you have high LDL, you have high APOB, you have a very high risk of getting a heart attack or a bypass. Now, here's the good news is we can prevent this and make sure that we use medication if we don't focus on our lifestyle or if we do focus on our lifestyle and we need a advanced medication that's going to help us. Focus is going to be focusing on decreasing LDL cholesterol by attaching itself into a protein in your body called PCSK9. And this is a PCSK9 inhibitor. So having a high cholesterol, like we talked about, like LDL, which is a type of cholesterol, increases your risk of heart attack. There are good cholesterol, though, like HDL. So think healthy HDL. Repatha, what it does is it focuses on lowering your risk of these issues by focusing on the protein that may be increasing these cholesterol components into your bloodstream and affecting your overall vascularity. Now, let's talk about this. This is used in children and adults both, but it's based on a specialist diagnostic criteria. Now, you need to make sure, like I said, you're running labs, you're talking to your doctor about this. So this, in my experience, anecdotally, has been an extremely effective medication in preventing cardiac disease. Now, let's talk about conditions that could be a cause for allergic reaction. These are also side effects. You want to make sure that you consider all of these. And I will attach the article, this specifically, in the link below to help make sure you talk about this with your doctor. Now, last thing, you want to make sure that if you do have any side effects, you report them immediately to your doctor. So make sure that you do look at some of these things before you decide to take this. But in regard to the recommended tiers of medication, this is something that is up there with the standard. Now, this is a more expensive medication, FYI. So lifestyle intervention should be the first priority. Measuring your diet, your exercise, your physical activity that is outside of exercise, like your steps per day. These are all things you should measure before you decide to jump into medication. So if you've already been doing a great lifestyle, you have a genetic risk predominance where, let's say you had a cardiac event your parents did before the age of 60 or 55, you should be looking into this and along with your genetic profile. So with that being said, these are some things that you can do to look into medications, but make sure that if you have any questions to reach out to us so we can help guide you in this approach. Hey everybody, Coach Austin here. We're going to dig into